Hi guys, welcome back to Dami RX Care channel. Ladies and gentlemen, you're welcome to this channel where we talk about medications and how to use them properly. So today we're going to diverge a little bit and talk about the COVID vaccine. So I need some drum roll, please. All right, so I've been getting a lot of questions about the vaccine, so I figured this is the best channel to get the information out there. I am an immunizer, so I do partake in giving immunizations, especially the COVID vaccine, to patients. So I am well versed in this topic, and I've been able to kind of ask patients here and there how they felt about the vaccine. And I still feel like there's a whole lot of controversy out there regarding whether or not to take the vaccine. So I hope this video is going to be able to help you to kind of make that decision whether to go for it or not. And I hope the answer is to go for it, because yes, we all need to be vaccinated in order to be protected from this virus called SARS-CoV-2. All right, so let's go ahead and dive right into it. So as of right now, yes, so we do have about 4 vaccines. So there's the Pfizer brand, there's the Moderna, and there's the Johnson & Johnson, and lastly, we have the AstraZeneca brand. So all 4 of these are not approved by the FDA yet. So they're authorized for an emergency use in order to protect the population from COVID. All right, so here in the US, the vaccine that we're pretty much given here are the Pfizer, Moderna, as well as the Johnson & Johnson, and that is what I am going to be talking about in this video. So like I said earlier, they're not approved yet. They're authorized by the FDA for an emergency use, like I said, in order to help patients prevent COVID infection. Okay, so first vaccine I will be talking about is the Moderna. So the Moderna is a 0.5 milliliter intramuscular vaccine that is given as a 2-dose series. So it's given as 1 dose, and then about 4 weeks later or a month later, you get your second dose. So it is about 100 microgram of the synthetic mRNA that encodes for the COVID virus that's inside the Moderna vaccine. So a common adverse effect of the Moderna vaccine is pain at injection site. We have fatigue, headache, fever, chills, muscle pain, arm pain. So these are the common side effects that I've heard patients talk about. Most of the time, most of my patients, the only thing they pretty much complain about is the sore arm. So most patients don't really have those really strong adverse effects such as fever, chills, or headache. There have been some patients that I come in contact with and they said they had it with the first dose, but it's really mild and it doesn't last any more than 2 days. So it's just your body kind of readjusting to the vaccine. All right. So what is a severe adverse reaction of the Moderna vaccine? So one of the severe adverse reaction is called lymphadenopathy. So it's a situation whereby your lymph nodes, so your lymph nodes are the one in charge of helping with your immune system, making antibodies in order to help prevent you having a severe reaction when next you come in contact with the infection. Okay, so your lymph nodes kind of get swollen, and in this process, it's known that they're creating those antibodies to kind of stimulate your immune system to say, hey, we've seen this before. Next time we see this, we're going to crush it. We're going to destroy it. And this is how we're going to move forward. So basically, when that lymph nodes get swollen, another thing is you want to make sure that you get it checked out by a primary care physician, because there might be so many other conditions that can cause that lymphadenopathy. So it's not necessarily the vaccine. So you want to make sure you talk to a healthcare professional just so they can kind of figure out if that is from the vaccine and it's going to go away after a period of time, or if it's, a condition that you need to get checked out for. All right. So another not common, but another severe reaction of the vaccine would be an anaphylactic reaction. So maybe you're allergic to a component of the Moderna vaccine, and your throat start closing up. It's just like people are allergic to like shellfish. Your throat start closing up, and patients may faint, or they stop breathing. Not that there's a shellfish component to Moderna, but I'm just giving that as an example. So that is, an anaphylactic reaction. So pretty much it can happen with the Moderna vaccine. All right. So another adverse effect of the vaccine is rash or angioedema, where it's like your lips get swollen or some parts of your face get swollen as a result of an allergic severe reaction to a component of the vaccine. So that is that about Moderna. So I'm going to go ahead and talk about Pfizer. So the Pfizer vaccine is a 0.3 ml milliliter intramuscular dose that's given about 3 weeks apart. So you get your first dose, and then 21 days later you get your second dose. All right, so there's about 30 microgram of the synthetic mRNA encoding for that COVID virus in the vaccine. So usually, like I said, a common adverse effect with this vaccine is the fatigue, headache, chills, pain at injection site reaction, fever, arm pain. Those are like the common adverse effect that patients have reported. Usually, if you feel that fever, headache, or chills, we recommend taking a Tylenol over the counter, and it usually goes away after about 2 days. It doesn't last for a long period of time if it's relating to the vaccine. All right, so a severe adverse reaction to the vaccine for Pfizer, like I said earlier, for Moderna, is lymphadenopathy. So where your lymph nodes kind of get swollen, and in this process, it's tagged to be your lymphatic system creating like antibodies towards, getting rid of the vaccine. Okay. Also, the lymph node can be the lymph node under your arm. So it may get your underarm may get a little swollen. Usually it goes away after a couple of days. So it comes and it goes away. If it's staying longer than, a week or so, you probably want to get it checked out to make sure it's not another condition that you have that is causing that. Okay. All right. So, and also there might be some anaphylactic reaction. I personally haven't seen anybody have like an anaphylactic reaction. The most I've seen is patients, they get so anxious about the vaccine. Their heart is already racing right before they even get the vaccine. And some patients still have fear of needles, where, they kind of get shaky a little bit when they get vaccine, any type. So they might feel a little dizzy or clammy after taking the vaccine. And after just sitting down about, 15 minutes or so, they're usually good to go. So for the last vaccine is the Johnson & Johnson vaccine. So this is a single dose, so you only have to take it once, and it's in a 0.5 ml. It's known to have 5 times 10 raised to power of 10 of the virus vector particles in it. And the adverse effect is similar to the other vaccine, which is pain at injection site, fever, headache, chills, arm pain, as well as headache, fatigue. So like I said, if the fever, headache, or chills, if any of that happen, you can take a Tylenol, and that usually pretty much helps with it. A very severe adverse effect that happened, very commonly when the Johnson & Johnson vaccine came out was the condition known as thrombocytopenia with thrombosis. So that is when patients have blood clots in addition to lower platelets. So usually in this patients, they found that it was more common in female patients who are around the age of 18 to 49. And this happened about 1 to 2 weeks after they got their vaccine. So some patient, I believe, passed from it, but they restarted the vaccine, and after doing multiple research on it, they found that the vaccine was still good to be administered to other patients. Those patients may have had a pre-existing condition that led to, that condition happening to them. All right. So what is a limitation of the Johnson & Johnson? So it has a limitation whereby not all patients who are vaccinated with the vaccine are fully, protected from the vaccine. So not all patients that receive the Johnson & Johnson vaccine are fully protected from ever having the COVID infection again. So, and also for immunocompromised patients or patients who are taking medication that can cause, they're called immunosuppressants, such as like cancer patients, HIV patients, patients that have lupus, like an autoimmune disease. These patients are known to show less effect of the vaccine in those patients. So those patients might want to go for the other two, which is the Pfizer and Moderna, in order to be able to be fully protected from the COVID infection. All right. So I'm going to do a quick comparison of all three, just so we can kind of get all those in summary. So for Pfizer, Moderna, and Johnson & Johnson, like I said, they're not approved yet. They're authorized for emergency use. So all of them are authorized for emergency use. For the Pfizer vaccine, it's a 2-dose series. For the Moderna vaccine, it's a 2-dose series as well. However, for the Johnson & Johnson, you only have to take it once. So for the schedule for the Pfizer vaccine, you take your first dose, and then 3 weeks later, you take your second dose. So you have up to 4 months to take your second dose. For the Moderna vaccine, you take your vaccine now, and then 4 weeks later, up to 4 months, you have to take your second dose. And the Johnson & Johnson, like I said, is just 1 dose and you're done. All right, so what type of vaccine are these? So the Moderna and Pfizer vaccine are mRNA vaccine, while the Johnson & Johnson is a vector vaccine. So there's a couple of difference between how the Moderna and Pfizer works, as well as how the Johnson works. Okay, so Pfizer is approved for patients 12 and above. Moderna is approved for patients 18 and older, as well as Johnson & Johnson is approved for patients 18 and older. Okay, so when are you fully protected after getting the vaccine? So for Pfizer and Moderna, you're fully protected 2 weeks after your second dose. So 2 weeks after you get your second dose, you're good. So according to research, you're good after 2 weeks of getting your second dose for the Pfizer and the Moderna. For the Johnson & Johnson, they said that you're fully protected after 2 weeks after you get your first dose. Remember, I said the Johnson & Johnson is only 1 dose. So 2 weeks after that 1 dose, you're fully protected from the COVID infection. Okay. So what is the effectiveness like? So the Pfizer has a 95% effectiveness towards the COVID infection. So you're 95% covered if you take the Pfizer vaccine, and pretty much 95% coverage of prevention against the COVID infection. And for Moderna, that's 94.5%. So that's about 95% coverage of prevention from the COVID infection as well. And for the Johnson & Johnson, they said it's about 66.3 to 66.8% coverage from the COVID infection. So you kind of have to weigh out which one is more effective and which one. I have patients who will come in and say, I'm traveling and I need to, be fully vaccinated for my travel. And they might have to travel tomorrow. So the Johnson & Johnson might only be their best option in that case. So you kind of have to weigh your options and see which one is best for you to take and just hope for the best. All right, so I hope this video was informative enough to kind of help guide you into what vaccine you should be looking at taking, or, you know, things that you need to be aware of before taking the vaccine. All right. Make sure you leave your comments as well as like and subscribe, just so when we post other videos, you're able to get alerts and be able to watch them in order to get various information from our videos. Thank you very much for listening, and we hope to see more of you, and stay blessed.